Welcome back to Inside the Wellspace. I'm your host, Cathy O'Brien, and today we're talking about a topic that too often gets overlooked until it's way too late: our eyes. Did you know that 2/3 of the world's blindness occurs in women? And much of it could be prevented with proactive care. From hormones and inflammation to autoimmune disease and screen time, our eyes tell the story of our overall health. And yet, most of us don't see an eye doctor until there's a problem. Joining me today is Dr. Nancy Coles, a renowned ophthalmologist in New York City, attending surgeon at Mount Sinai, New York Eye and Ear Infirmary, and a leader in advancing cataract and anterior segment surgery. She's here to break down what's happening inside our eyes, from dry eye, glaucoma, cataracts to macular degeneration, and what we can do right now to protect our vision for the future. This is an episode that will change the way you think about eye health. So let's get started.
Cathy, thank you for that beautiful introduction.
Oh my goodness. Well, thank you so much for joining us. I'm so happy to be with you. I'm always happy to see you. I always learn so much from you. I'm happy that you're willing to share all your knowledge with the fabulous women who want to learn things about themselves.
I'm looking forward to it.
Awesome. So why don't we start by you telling us about you, your practice, and what it is. What's your world? What do you do?
So I'm a solo private ophthalmologist, been doing it for 35 years. It's no accident I ended up in medicine. I have a grandfather, a mother, a father, 2 brothers, older brothers who didn't do it. So it fell on me.
Family business. Someone's got to do it.
Fell on me. I took over my father's practice. It's over 85 years old in the same space. It's been the best thing I've ever done. Helping people every day see has been very rewarding.
You know, I came to you at a youngish age. I don't know why. Maybe Holly made me go or something, but thank God I did. So, let's sort of get into that around, what I said in the intro about how oftentimes people the eyes are on the back burner of your overall health. So you said something, you said 2/3 of global blindness is women.
Staggering, isn't it?
Yes.
Staggering. Even when I read it, staggering.
Yes. What is that? Why?
So when you break it down, it becomes maybe a little bit more manageable and understandable and something we really need to fix. First and foremost, women live longer than men. On average, a good 5 to 7 years longer. So the diseases we're talking about, cataracts, macular degeneration, glaucoma, these are diseases of the elderly. So it would make sense that there would be a higher proponent of women.
Right.
But then when you delve into it further, women are caregivers. And they've been brought up to be caregivers. And they will take care of their grandparents, their parents, their spouse, their children, before they will take care of themselves. And this is attitudes that I think we need to change so that women have their best eye health, so that they can give the best eye health and the best help to their loved ones. Also, as we age in women, there's hormonal changes. And we are just beginning to understand now how these hormonal changes lead to inflammation everywhere in the body, but most impressively in the eyes.
Isn't that wild?
And that's why we are at a higher risk as women than men.
Because of our dramatic hormonal changes that we experience throughout perimenopause and menopause. I mean, all of it. It's like ups, downs.
But it's the drop in estrogen and the variable androgens that cause shifts, and that results in less neuroprotection, more oxidative stress, and that leads to inflammation.
And it manifests in the eyes. Well, among other places, but wow. So what exactly is blindness then?
So blindness is loss of vision.
Yeah.
You can have blindness from reversible causes, like you just need a pair of glasses. You're nearsighted, you're farsighted, you have astigmatism. Cataracts is a cause of blindness. It's actually the leading cause of blindness outside of the United States, but that can be reversible if you were to have cataract surgery. And then there's non-reversible causes of blindness, more commonly macular degeneration and glaucoma.
Okay, so sidebar about the glaucoma and why it's important to get your eyes checked is that when I was in my 30s, I think it was, and Holly told me to go see you just in general, you found narrow-angled glaucoma in me, which is not a common thing, but you found that. And why don't you just explain what that is? Because that could have caused blindness for me. It's a serious thing.
Absolutely. So you had narrow angles, not glaucoma yet.
Right.
And that's why it was important for you to be seen in
Yeah.
your 30s.
Mm-hmm.
So your eye is shorter than the average eye, but you have the same amount of eye contents as everybody else. It just got smushed into a smaller area.
Huh.
And so that crowding
Mm-hmm.
causes problems with the flow inside the eye of fluid that you're making. You make nutrients, your eye extracts the nutrients, and then you got to get rid of that fluid so that you can bring in more nutrients that have fluid, and you keep feeding and bathing the eye. But for you, that channel was very narrowed just because everything was squished in there.
Yeah,
And so we had to do a laser to make space.
we did.
Now, had we not done that, then you run the risk of developing chronic angle closure glaucoma later in life.
Right,
And that is very hard to treat.
right.
So we actually got you before you got to the glaucoma stage.
Which is thank God, right? And this is so I am an example. I'm an
Absolutely.
example of a reason why when you're in your 30s, just go to the eye doctor.
Just go.
Go. Okay. So that is really good to know. So macular degeneration of your eyes is age related, you said, right?
Yes.
You said what happens there?
So macular degeneration is loss of tissue or atrophy of the central part of your vision, which
Okay.
is called the macula. The rest of your retina is completely healthy, but that area, which is the central part of your vision, which helps you read, drive, recognize faces, that atrophies. And that atrophies for many reasons. One of it could be decreasing estrogen.
Again, with the estrogen.
Less neuroprotection of the cells, more oxidative stress that causes atrophy. It causes thinning.
Yeah.
And when you have that thinning, the body tries to protect that by bringing in more blood vessels in. And when it brings more blood vessels in to bring oxygen, to bring nutrients, those new blood vessels are very fragile. They're little baby blood vessels, and they bleed easily. And that's when you go from the dry form of macular degeneration to the wet form of macular degeneration.
Okay. And then when those blood vessels like burst or seep or whatever, that causes that
That makes it now the wet form of
The wet form.
macular
Okay, got it.
degeneration.
Oh, yeah. That does not sound good. And then inflammation, you said, in the eyes, but you said that can be treated or controlled or
Well, there's lots of
ameliorated.
ways starting from childhood. UV protection starting in childhood. Now we see babies in the street wearing sunglasses. This is important. Blue light filtering is really, really important. Healthy eating, healthy living, orange and green fruits and vegetables, not smoking. These are all things that we can do, decreasing our own internal stress, sound mind and body practice. All of this helps decrease the inflammation in our body and in our eye. And it's important to do this so that when estrogen levels change, when we age, our body is better able, it has better armor to fight these changes.
Yeah, the thing about when you say inflammation and all of these ways that we can actually help ourselves, it really applies to so many different facets of our body. But knowing about the eye is really important for us. I think it's important to be front and center. There are issues that we talked about when it comes to blindness and what affects us. And you mentioned for women, autoimmune disease being something big.
So this is another reason why 2/3 of the population, is women.
Yeah.
We are 80% more likely to get autoimmune diseases. So autoimmune diseases are diseases like rheumatoid arthritis, lupus, thyroid disease, Sjogren's. These are inflammatory diseases of our entire body, of the cells in our body, of the blood vessels in our body. So it makes sense that the eye would be affected.
Yes.
And so the eye gets affected mainly in terms of blood vessels, and that can lead to changes in bleeding and cause blindness from there. And also a lot of dry eye disease comes from that.
Oh, is that right? Wow. Comes from autoimmune.
Autoimmune.
Oh my God.
Because the whole surface of the eye is irritated and inflamed. So that's what autoimmune disease is. It's inflammation.
It's inflammation of different parts of your body. Oh my gosh, that's fascinating. I didn't realize that. Yeah, and the eye just isn't looked at really or studied, is it? When it comes to autoimmune?
Well, it is studied. It is studied.
Okay,
it's just that we come so late to the diagnosis.
Yeah.
And so if a young woman comes to me, or a young man for that, comes to me with very severe dry eyes, I know to delve into looking at the rest of their body, because what is this telling me that's showing up in the eyes that probably there is something autoimmune brewing, or at least we should be looking for it.
So then what do you do? How do you address that when you're looking for
blood tests? Work in conjunction with a rheumatologist, with the internist, looking for any systemic disease. I'm still going to need to treat the eyes. That's not going to change.
Right.
And it's going to have remissions and exacerbations just the way your body does with autoimmune, and you're going to get flare-ups.
Yeah.
And I still have to manage all of those, but being able to keep yourself again as healthy and uninflamed as you can will help with your overall health.
Yeah. So I keep coming back to the inflammation thing, because how do we even know inside of our, I wish there was a way to see inflammation in your body.
It will happen.
Yeah.
It will happen.
Yeah.
We're just spending a lot of time trying to understand inflammation. And looking at the eye is such a good place for us to see, starting from the front of the eye with your tears, going all the way to the back of your eye to your retina with macular degeneration, and seeing the effects of inflammation. And people who have genetic predisposition, how does inflammation allow that gene to manifest itself in a way that if you didn't have that inflammation, maybe the gene wouldn't express itself?
Oh, interesting.
Again, reasons to start early with eye care, eye health.
Yes. I think we all need a checklist. Every person in their 20s needs a checklist. And this is my personal philosophy, around your birthday, check the box. Eye, GP, gyno.
Absolutely.
What else? Dentist.
But nobody puts the eyes there unless they need eyeglasses.
You know what? You're absolutely right.
And even internists don't.
What is that?
They don't tend to refer. It tends to be more reactive. You have a red eye, you have a problem, go see an ophthalmologist. And I don't know if it's in the routine checklist.
We need to change that. We need to get out there and change that.
We are right now.
We are. And I'm happy. So let's talk about dry eyes, because it's a big thing. And you said it's a huge business now too.
It's a huge
And
business.
how many women does it affect?
So depending upon your age, I would say overall statistics, anywhere between 20 to 40%.
Oh, goodness.
And about 10 to 15% of men. It's not just a disease of women, but it tends to be higher percentage in women.
Okay.
Again, because of hormones.
Yeah.
So we are seeing, and I think I told you this before, we're just beginning to understand dry eyes. But before I even get to the older woman, I want to talk about the young kids, that we're going to start seeing more and more dry eyes, because we're bringing kids up on computers and smartphones, and they're staring all day long.
Yes.
And when we stare all day long, we don't blink as much because we want to get that information in. And with a blink, we lose where we are. So we have incomplete blinks. So we stay always looking where we're focused.
Yeah.
And when you have those incomplete blinks, the meibomian glands, the glands in your upper and lower lids, don't touch. And when they don't touch, they don't get stimulated. And when they don't get stimulated, they atrophy. And when they atrophy, then you have an abnormal and inflamed tear film. And so we're beginning to see this in younger and younger age population.
Wow. That is frightening, actually, because culturally it's and here again, with culture, as culture changes and society changes, disease changes.
Yes.
Am I right? I mean, we look at jobs changing, but really actually our own physiology and
our adaptation
changes. Wow. Interesting. So these poor kids, it's the screens, and you mentioned also sunglasses. Is this?
So sunglasses, certainly the sun is irritating. UV light is irritating. Sunglasses, I think, is very important for macular degeneration, especially if you have light-colored eyes or if you have a family history. And dry eyes does tend to be a disease of older women.
Okay.
And that is because of the estrogen shifts.
Got it.
And that estrogen is protective to us. And as it falls pretty precipitously, our protection is gone.
Yes. In so many ways. Do you know what? And okay, light bulb in my own head, because for the past year, I've been taking this anti-estrogen pill from the breast cancer, and my watering eyes has just literally turned up. Could that be a
Absolutely.
result?
So dry eyes is either you're not making enough tears, or the tears you're making are inflamed.
My tears are fake. I have fake tears. They're inflamed tears because
Yes,
I'm not crying.
exactly.
Like it's, but
that's exactly what
they're
happens.
fake
So
tears.
there's 3 different glands that make your tears.
Oh.
And you need all 3 of those glands to be working in perfect harmony to make the right pH, to have those tears stick to your ocular surface.
Right.
If you have anything that changes one of those glands,
Right.
the pH is wrong, and the tears don't stick to the ocular surface, and you tear.
My poor eyes are they just
Tearing.
want the ocular surface to be stuck
They
to.
just want you to replace it and replace it with artificial tears.
Okay, I'm gonna
and
do
that's what you need. So tearing is one of the hardest things for me to explain to patients because it really means your eyes are dry. And they're like, no, but doctor, I'm tearing all day long. That's not my
Right.
problem.
I think you said that to me once. I was
Yes.
like, no.
Yes,
and then I just moved on. Right. Yeah.
Yep.
That's so funny. Do you see a lot of that?
I see a lot of that.
Yeah.
I see a lot of that. And also you'll get burning, redness, sandy, gritty, foreign body sensation. Those are all dry eye disease symptoms.
Is it an autoimmune thing?
It can be.
It can be.
It can be.
Okay.
It can be. So autoimmune diseases have a higher risk of dry eyes.
Huh. Interesting things to think about as I endeavor in my whole body investigation after my cancer. I just want to check everything out. So maybe that's something to investigate. Okay. You mentioned something about the dry eye business, that it is literally booming now. It's becoming a monetary
It's
thing.
a multi-billion-dollar project.
What
and
happened?
I'm going to say thank goodness, because it's bringing awareness
Okay, good.
to dry eyes. It's bringing awareness to inflammation. It's giving awareness to how we age and what supports we need as we age. And as we've said, even starting from childhood, from infancy, what do we need to do to protect our eyes? Because the insults that happen 30 years later are the ones that show up on our body, that show up in our eyes. So starting at a younger age is going to be so helpful. And it's starting the awareness of. And there's so much out there now for dry eyes.
Yeah.
I mean, do not despair if you're sitting here tearing a little bit there. And if this doesn't work, there's that and there's that, because we're doing so much research into it.
Good.
And not everybody's dry eyes is the same.
Okay.
And it's really important that your ophthalmologist understands what's causing your dry eyes as opposed to the person sitting next to you.
Yeah.
Because the treatment will be slightly different.
Okay. Good. I'm making an appointment. We're going to go through the big guys that we talked about. So cataracts. Can you explain what they are and that we all have them? Is that true that we all have
We all
them?
do. So we all have a lens in the eye.
Okay.
And the lens is like the lens of a camera. You can have a telephoto lens, you can have a regular lens, and that lens takes all the light from the outside world, puts it together in one spot in the lens, and then shoots it to the retina, to the central part of your vision, and that's how we see. So a lens needs nutrients, and so it has a little pump mechanism in it that makes nutrients in a fluid. The lens extracts that fluid, and then this pump pumps out that fluid that has no value anymore into the eye.
Okay.
As we get older, that pump poops out. And as it poops
poopy
out, it's a pooping pump. And as that happens, water stays inside the lens and the lens swells.
Oh.
And as it swells, it becomes translucent and then it becomes opaque.
Yes.
And then
it's just fluid?
It's just fluid in there. So early signs will be, and they're very early, you're walking into a room and you're like, who put 40-watt light bulbs instead of 60-watt light bulbs? And you're busy turning lights on everywhere. Or when you want to read, you're looking for light or you're looking for more magnification. And that's because that cloudy lens is absorbing the light rays rather than transmitting it to the retina.
Okay.
So you need more light rays so they'll be transmitted.
Isn't it fascinating? But this is so good to know because we're all experiencing it as we get older. I literally feel like I live in a perpetual dimmer switch.
Correct.
That everything is just going like a little bit,
a little bit, very slowly.
Yes.
It's very slowly, very slowly.
Oh, it's driving me nuts. So that's good and reassuring because it's fixable. And you said that surgery is definitely not a big deal.
Definitely it's not a big deal.
Not a
it
big deal.
requires respect because it's real surgery.
Yeah.
And we are opening the eye, even though we talk about lasers and we do lasers with cataract surgery, but we are still opening the eye.
Yep.
It is Anesthesia is similar to a colonoscopy.
Yes.
It's 10 or 15 minutes to do the surgery. It's painless before,
Right.
during, and after.
Right.
And we have lenses now. So if we take the lens out, to go back to the analogy of a camera,
Yeah.
we need to replace it with a new lens.
Right.
And we call those intraocular lens implants.
Okay.
And those implants can give you distance vision, near vision, or both.
Okay.
So you can have the vision you had when you were 12. So there is a silver lining to
Yeah.
getting, I can't wait till I have cataracts and I can get rid of my contacts.
I'm actually, when we spoke about this a while ago and I thought, oh, I feel so much better about this now, just
yes.
because
it's exciting.
there are things that loom as you get older and you worry like, oh, what if that? But this is not something to really worry about, you know? Thank you. That's great. And then just sort of like a little sidebar, what are floaters?
Floaters are what I call, and I told people, they're wrinkles in the eye.
I love that. Wait, that's so funny.
It's really, and I say that to kind of relax people.
Okay.
So floaters are like you're outside on a bright sunny day and
Yep.
you see like a little cobweb or a little fly or something and you keep looking for it and it's not there. Between the lens and the retina, there's a fluid-filled cavity called the vitreous humor, the vitreous gel. And it's like a well-made jello when we're born.
Mhm.
And as we get older, it shrinks and liquefies and you get these clumps of well-made jello floating around in this kind of half-baked jello.
I'm like trying to it's such a funny visual, isn't it?
It is,
It's
but
so
they just
intricate in
kind
there.
of float by. So I try and make a joke with my patients
Yeah.
as long as they have no retinal pathology, because you do need to be checked to make sure
Yep.
when that floater formed, it didn't take a little piece of the retina with it and cause some problems. I tell people you're never alone when you're with yourself. You always have your floater to keep you company. And I make a joke just to
It's
let
so
them
funny.
relax, to
Wrinkles
know.
for the eyes. Could there be
Yes.
some Botox for the eyes as for the face? They're normal, mostly harmless until they're flashing lights.
Right. So
What's that?
times to call your ophthalmologist,
Uh-huh.
or if you have like a little camera flash, a little flashing light going off,
Okay.
or if you have a whole shower of floaters that you can't see through,
Ooh.
or feeling like there's a curtain or a shade in front of your vision or dust in front of your vision, or if you're very, very nearsighted.
Okay.
Those are reasons to be checked. It's
Okay.
not a 2 a.m. emergency. It's
Mhm.
a call at 9 a.m. the next day kind of emergency.
Okay. That's good. That's good to know too.
Yes.
That's actually very good to know. Okay, we spoke about glaucoma and now angle, but let's talk a little bit more in detail about that. You said it's the leading cause of blindness.
Yeah.
Yeah.
Yeah. So glaucoma is silent.
Mm,
And that's why it's important to have regular eye exams.
yeah.
Glaucoma, for the most part, open angle glaucoma, the types of glaucoma that most people that we follow them for, it's just high pressure to the optic nerve that causes damage. And glaucoma, if I had to make an analogy for glaucoma, it's like just very slowly turning down the dimmer on a light switch.
Mm,
And what happens is this high pressure causes loss of your vision way out in the periphery.
mm.
And it comes, and if it's left undetected, you end up getting central loss. So
Mm.
by the time you are affected by glaucoma,
Mhm.
if you haven't seen any by then, it's often too late for us to be able to do anything.
Oh,
So
gosh.
you have no signs and symptoms. Now, with the type of glaucoma that you didn't have, but the acute,
that I could have.
you would have
Yeah.
pain, redness,
Yeah.
and rainbows, halos. You would know something was wrong and you would seek care.
Right.
But this is like hypertension. You don't feel your
Yeah.
own blood pressure.
No, and then all of a sudden you have a stroke. I
Correct.
mean, it's
Yes.
very, very dangerous. And it also is really not a big deal to get the test. When you go for the regular eye exam,
It is
that
not.
little glaucoma, boop, where it pops
It
into
is-
your, and you measure the pressure. It's like it's like a big nothing,
It is, and
But
it's
it's
not
so-
really a boop, because I don't want you to misrepresent that. It's very
air, right?
light.
Is it
There's
air?
no air.
Oh, what is it?
So that's an old-fashioned technique.
Oh,
So now there's two ways to do it, and the best way is we anesthetize the eye with a drop.
Yep.
Which lasts about 3 to 5 minutes. That drop.
yeah. There's no.
And we very gently tap on the eye, and through that, we see how hard it is to push the cornea, which is where your contact lens would sit.
Yeah.
And we get a value for
Okay.
what your eye pressure is.
Okay.
There's nothing that shoots into the eye, so that there's nothing to be frightened of.
No,
it's
it
not
doesn't-
painful.
not
It
at
does
all.
not hurt.
No, I'm so glad you explained that, because it doesn't hurt at all.
It used to be a whoosh of air.
Yeah, maybe that's
and
what I'm remembering.
that was found not to be very reliable. So
Okay.
now we have a more reliable.
Love it. And the other thing that is not happening anymore is the dilation of the eyes.
Yes, this has really changed.
Totally.
Really changed.
Yeah.
We do a dilated exam on a computer.
How?
So we have a machine that takes a picture of
is
your
that
retina.
the thing where you stick your head
Yes,
in?
Exactly. And then I say, I'll be right back. I'm just going to the computer.
Yep.
And now I have a picture of your entire retina. And when I look at your retina, normally when I would dilate you, I look up, down, left, right. I'm looking at each segment.
Yep.
Now I look at 360 degrees. I get the full picture all at once.
Oh.
And I have a record of it so I can compare this year to last year to the year before to 10 years ago.
Oh my God. And then do you every year when I come see you, do you look at what was just taken versus last year?
Always.
Do you also go back or no?
So if I see no pathology, I probably won't.
Yep.
But if I see anything, I will go all the way back to say, when did this start?
It
and I can look and I can see it.
Oh God, isn't that awesome?
Yes.
So we're talking now too, and it is just mind-boggling to me how intricate the eye is and what
beautiful.
All the little things that make something happen. Is there what's the brain inside the eye? Is it the retina? Is it what's the controlling factor?
It's all of it. I mean, it does have nervous tissue that then talks to the brain. It's an organ.
It is an organ. It's beautiful. It is beautiful. Wait, I'm going back to glaucoma for a second because I'm looking at what you said too. You said that lowering your eye pressure halts the progression.
Correct.
How do you do that?
So you can drops.
Oh, eye drops. Okay.
Eye drops.
Fine.
It's as simple as that. Now, you can also have lasers. There's other lasers besides the one that you had. I mean, think of it as water coming into a bathtub, water staying at a certain level as water drains. So the water in and the water out is at the same speed.
Yep.
And so since it's the same speed, the water stays the same.
Got it.
If you turn up the water, but it's still draining at the same speed, it's going to go higher.
Right.
And if you clog that drain, it's going to go higher. So we have drops that take care of either of those, or lasers that clean out the drain.
Love that.
Or surgeries. And surgeries are less common.
Right.
We would like to have gotten it before we needed that.
Good. And so then that goes back to everybody needs to go see the ophthalmologist around their birthday every year.
Yeah.
Starting in your 20s.
Once or twice in the decade of your 20s.
Oh, okay.
Okay. And then you went maybe every 3 years in your 30s.
Okay.
And then starting in your 40s every year.
Every year? Oh, I like that. Okay. That's good. Then I was an overachiever.
Yes,
I was
but
an overachiever.
thank goodness.
No kidding, right? You said in the high pressure to the optic nerve causes damage to the optic nerve. That's what glaucoma is. And then you said in normal pressure glaucoma, there's a lack of,
So we have 3 different types of glaucoma.
Okay.
We have regular open angle high pressure glaucoma.
Okay.
We have the type that you had.
Yep.
Potential risk for narrow angles where everything is just squished in there.
Yep.
And then there's this other entity where your pressure is completely normal, but your optic nerve has pathology.
Oh, got it.
And that's called normal tension glaucoma. In those patients, it's more vascular. People have sleep apnea.
Mm-hmm.
People have migraines. People have Raynaud's disease. Again, autoimmune diseases come into this and play against inflammation. But all of this has to do with the blood supply to the eye.
Okay.
And so changes in blood, people who have hypotension, they have very low blood pressure. The brain is going to say, you're not going to the eye, you're coming to me.
Right.
And so the eye doesn't get enough oxygen. People who spend a lot of time standing on their heads are, yoga, things like this, all of which should be done.
Yes.
And a good reason to know, are you at risk for normal tension glaucoma?
So good to know. Very good to know that this is real and all very possible, and just know about it. That's all. So we talked about that eyes are getting a little bit more play now, which is great. And you said something about money in premium lens implants.
So probably what I was saying was that it's so exciting what we can do now.
Yeah.
And again, because it's becoming more of a business, there's more research in all of this.
Yeah.
And now we can offer you the vision you had when you were 12. We can offer you spectacle-free, maybe 90% of the time,
Yep.
not 100% of the
Yep.
time, but we can offer you vision where you can see distance, intermediate, and near without reaching for your glasses.
Nice.
And so that is very exciting.
I think it sounds great, especially as I get older. I mean, all of us, not me.
Yes.
I mean, as we get older,
Yes.
I think it's really great. And two, you suggested to put off the readers for as long as humanly possible, because once you start to get dependent on them,
Yes.
then
You want to keep your eyes working.
right.
And if you get the glasses too soon, or if you go and you just get the over-the-counter magnifiers and you choose ones that are too strong,
Right.
your eyes get lazy. They say, oh, you're going to give me glasses that are going to do the focusing? I'm not going to bother
Right.
to work.
Right.
And so they're not working anymore.
Right. And I've definitely appreciated that over the years you've said no. You need to stay at the level you're at. You can't go. I'm like, oh, darn, I can't see. No, but it's okay. And then we talked about the importance of proactive maintenance in your sort of vision of what that looks like, of just overarching eye care in general as we grow in age.
So I think that's healthy living,
Yeah.
a healthy lifestyle. UV protection is very, very important. Taking care of your eyes takes care of your overall body. So healthy eating, green and orange fruits and vegetables, not eating too much meat, really being cognizant of what you're putting in your body, exercise, mind-body exercise, doing things to decrease your stress. All of these end up being very helpful to your overall eye health.
Yeah. It really...
And sunglasses.
Yeah.
Just the way you put sunscreen on your face, or
Always
hopefully
wear
you do.
sunglasses. I do.
Always wear sunglasses when you're outside. We know that blue light is toxic to the eye.
Isn't that fascinating? And then how do you feel about the blue light glasses that have become so prevalent these
So they're
days?
blue light blocking. Specifically on the computer. And prior to COVID, I might have gone, I don't know.
Right.
But I have to tell you that spending all this time on a computer now, it relaxes the eyes.
Does it? Okay.
I don't know what it does to the overall health. I don't think we know yet. We haven't done any studies.
Okay.
But I know now I do reach for blue light blocking readers.
Yeah.
Because when I'm looking at the computer, it does take away some stress. It takes away a little bit of glare. So I have become a proponent of it.
I'm happy to hear you say that. I will investigate that again. I did it during COVID and would get comments from people that say like, "Oh, you've got those glasses," because there's like a sheen.
There's a little
to
bit.
them,
You can
or...
even get a sheen on Amazon. They sell it. You can put it over your computer so that you can keep the same glasses you have.
Oh, really? See, that's good to know too. Tips.
Tips.
I love it. So much information. Is there anything as we sort of wind down this, wonderful, informative time? Is there anything that you would like to leave people with that we haven't covered that you'd like to talk about?
I think I'd like to just reiterate and bring home the same messages that we've been talking about, which is take care of your eyes and go for yearly eye exams. Practice sound mind, body, healthy habits is very important. And take care of your eyes every day. Because when you take care of your eyes every day, it's a gift that keeps giving to you. And it gives to you in terms of keeping your vision through your old age. And there is the saying, right? The eyes are the windows to the soul.
Yes.
I guess I'd like to add, they're also the windows to your body and to your systemic health. And that by giving yourself the gift of keeping your eyes healthy, you're keeping yourself healthy every day into old age.
We've talked in the past, as we're talking about overall eye health and, the things you can do, we have talked in the past about vitamins. What do you think about vitamins and supplements?
Yeah. So I get asked this question frequently. And I'm going to start off by saying, I think there is a role for them. And I'm a big proponent of them. Vitamin C is anti-inflammatory. Vitamin E helps stabilize blood vessels and the cell membranes. Vitamin A, we've all heard about carrots and how healthy it is. So in the form of lutein and zeaxanthin, it actually blocks the effects of blue light. And blue light is what causes oxidative stress and macular degeneration. So omega-3s are really good for people who have dry eyes, and they make lots of over-the-counter dry eye vitamins. And I just think we're going to start learning more and more about how important all of these vitamins are, because they all lead to decreased inflammation.
Yeah.
And inflammation is what we really want to keep down in our body.
I think that's really important. I was just thinking about vitamins actually earlier today, because I went and saw my doctors just to check in around the breast cancer.
Yes.
Right after going through everything, I took a pile of vitamins just because you're so hyper aware of, oh my gosh, I need vitamins.
Right.
And then I stopped because they kind of made me feel a little bit nauseous. But maybe it's time to go back and just do a handful. I mean, I was taking a lot of them. So do you take vitamins?
I don't. I don't practice what I preach. I would like to. I'm very non-compliant.
I love it.
Very non-compliant. I do always tell my patients, though, who have had cancer, please check with your doctor, your oncologist, to make sure that these vitamins that you're taking are appropriate.
Right. Yeah, that I did for sure. I mean, they check everything, which is terrific. I love them. And I just self doctored to decide not to, but I'm thinking now maybe I should.
I think your body tells you what you need.
Yeah, right. I agree.
So maybe one at a time.
Well, that's right. And you said A, C, E, and omega. That's manageable. Those are manageable to me. But I was better. So I think I'm gonna go back into that. Thank you.
You're welcome.
All right.
Thank you.
Thank you so much for listening to this episode of Inside the Wellspace. Subscribe now on Apple Podcasts, Spotify, YouTube, or wherever you listen to your podcasts.